Welcome to Hope, heartful outreach, positive encouragement. On this channel, we discuss real-life issues from a Christ follower's perspective. How can we improve our family lives, get out of debt, leave an inheritance to our loved ones, and use our talents to make an impact on our communities? Stay tuned for guest speakers who will share tips and resources to help you with these and other topics. Be sure to comment, like, and subscribe. And now, let's join today's guest speaker.
I'm here with Dr. Rob Thomas. Thank you for being here, sir.
Good morning. Thank you for allowing me to join you today. It's been such a pleasure meeting you as a person. And when you asked me if I would be interested in doing this, I was really excited because I'm a native of right here in Jacksonville, Florida. And I recently moved back, and I came back to the area because I was working with some of the sick and shut in the family. And I also work at this clinic downtown. It's called Volunteers in Medicine. I've been a weight management doctor with them since 2012 as a volunteer, but now I'm actually a paid employee, and my job really is to do marketing and outreach, patient recruitment and engagement with a specific focus on helping people understand how they can get their chronic diseases under control. And so for me, my passion really started back many years ago. In 2004, I started Global Health Christian Missions as a missionary. And for me, going around to different countries and having a conversation with people on a spiritual aspect, I also saw that a lot of the physical ailments were plaguing different people, particularly a lot of Christians. Some of the things that they were eating, some of the things they were doing, some of the things they weren't doing, so causing some issues for them. So I launched this organization, just really kind of get a better understanding of, helping people grasp some things that they can do on the spiritual aspects as well as their health. And so I started this in Malawi, which is in Central Africa, working with communities there. And from there, I went over to Mexico, and I've been going to Mexico probably at least 100 times working with them. And I have a specific church that I work with there. And it's really interesting because I'm a saxophone player, and taking my saxophone to Mexico has been such an important role in terms of helping people to, just get more interested in what I'm talking about. But that's that initial catch.
Yes.
They could get them interested in what I'm doing. So for them, there are a lot of issues with type 2 diabetes, of course, elevated cholesterol, as well as high blood pressure. And there's one instance where I was working with the pastor to address high blood pressure with the parishioners in Matamoros, Mexico. And it got to the point, where everybody in the church that we did the blood pressure screening on had elevated and abnormal levels.
Oh, wow.
And so the Lord gave me, really the mindset of, let's go ahead and focus on some lifestyle and behavioral health modifications that people can do. There's no medicine that you're going to be able to give them in Mexico. And so that's where this waistline thing that I like to focus on really came into play, because people have expanded waistlines. This is where all those vital organs are. So it really has an impact on their health. So that simple screening tool that I use also allows me, once I get my hands on it, to put my hands around people, to allow them to feel comfortable with me. So my role really is to serve as kind of like a clinical health educator, at the same time giving people spiritual hope. And so this has been such an important role for me in my life that I've gone on to Trinidad and Tobago, Manila in the Philippines, and just some other countries where I work with faith leaders and how to help their congregations to improve their health. So my background with working with weight management turned out to be something that I can do on a spiritual aspect as well.
I think that's amazing. I mean, wow. You've traveled a lot, and you've met all these different cultures, and it's interesting to note that we all have something in common as far as health concerns. So as you have gone to these different places, what do you see as the primary health concern? If you could fix that one thing, what would you say? I mean, I think I know what you're going to say, but if you could fix that one thing, what would it be?
So there's a lot of stress, and the stress, everybody has to face it. From Argentina to Zimbabwe, we're all dealing with stress. but the way that a lot of people use their coping mechanisms, it could be tobacco, it could be overeating, it could be substances that are illegal and illicit, just different ways of dealing with stress instead of casting our cares upon the Lord, for he cared for us. And so that's the message I really try to help people understand. And what happens with a lot of people is they're looking at me as a person and they want to know how I made it and why I'm able to do what I'm able to do. And so that's where I'm able to come in and share my message with them, in terms of what the Lord has done for me and things that I have seen and experienced. Because oftentimes they'll say things like, well, what's going on in this other country that you've been to? And it's all very similar.
Yes.
So, that message of hope is so important. It's very key and fundamental in everything that I do with people.
That's awesome. Well, see, that explains why I needed to have you on this show. As the more you talk, it just kind of, it blossoms, I didn't know you played saxophone. And a lot of times when I'm doing this type of thing, people are like, Bev, what does that have to do with music? Well, you said it very well. Music opens the door to conversation. Music is sort of that universal language that gets people to listen, and it draws people close, and now they can hear your message. So that was powerful what you said.
Yes. It's so nice because I can get my saxophone and then I can get with the musicians in Mexico. And sometimes there are other American missionaries and they bring guitars and stuff. We've never practiced, we've never met, and we're able to do our praise and worship and the devotion before church starts. And it's almost like we've been practicing for years. It's just really an amazing thing. And the way that the people receive us in these different countries is completely unbelievable. So that universality of music and how it reaches and touches people has been so amazing. And my saxophone, I tell you, I don't know if this horn is super blessed or what, but it has gotten me out of so much trouble. There was an instance where I had another missionary with me. We were picked up on the border, and the Border Patrol agents, they gave us a very hard time. And I'm a Black American. I had an Italian American with me. We were picked up by a Mexican pastor. And once they saw the three of us together, like, this just doesn't look right, as we crossed the border into Mexico in his truck. And so they're like, where are you guys going? What are you doing? I'm like, well, we're on our way to Bible study. And he's like, I need to see some passports. So I gave him my passport. She gave her passport. And the pastor's from Mexico. He's like, yeah, I live here. So what happened was the guy's like, something's not right. Pop the trunk. So we popped the trunk, and there was my saxophone. And he's like, whose saxophone is this? I said, it's my saxophone. Like I said, we're on our way to Bible study. And I play saxophone. And he says, oh, I'm so sorry, sir. And so he let us through. And so there's instance after instance with my saxophone, how it has actually caused people to kind of take a step back and look and say, wait a minute, these people are real. And, the work that they're doing is important.
That's an amazing story. So, yeah, I mean, I just firmly believe that when your heart is to serve God, he goes before you and he's going to open the door. If you're supposed to be there, he's going to open the door. If you're not and you get turned away, it's probably just for your own good.
Yes, I agree with that. Yes, definitely.
Well, that's a really cool story. So tell me about what you think, if you were to give people some tips about what they should do regarding their health. I mean, I am just for myself, I am not diabetic, even though I'm overweight. I'm not diabetic, and I thank God for that. I don't take it for granted because I do have two parents who struggle with that. Yeah. So if you were to talk about what you feel the most people should know about their health and what they should do to maintain their health, what would you say?
So I like to tell people really just focus on a couple of things. Number one, eating only during the daylight hours, because there's a circadian rhythm which separates the darkness from the light, and making sure people are eating so that they're working with their body's natural process. Okay. Focusing on things that are nutrient dense instead of everything that's tasty. And sometimes it's loaded with calories, and it could be very unhealthy calories. Another huge component is drinking a lot of water. And so I tell patients that are trying to lose weight, just go ahead and get on the scale. Let's divide that by 2. And whatever that 50% of your weight is, let's try to drink up to that amount and see if that's going to help. And it does help people a lot. Because
in ounces, do you mean?
Yes, in ounces. That's the most important nutrient for the body. And so making sure they understand that. as well as focus on keeping that level of stress down. And, you know, a lot of times calming music is really good for people.
Mm-hmm.
If they can focus on something that kind of enlightens them and lifts them up. It could be the gospel music, could be jazz, but something that's going to make them feel like, you know, out in the universe, all this positivity is landing in my lap.
Mm-hmm.
And, you know, I understand there are different types of music right now. Some of the stuff is extremely negative, but focus on what's positive and what's helpful.
Right.
And so another thing is to keep that stress down, moving the body at least 10 minutes at a time where you're raising that heart rate, because you know heart disease is the #1 killer worldwide. But the more we can get that heart, you know, pumping so they can move that blood throughout the body. And remember, the blood goes all the way from up to down, and making sure that we're getting sufficient oxygen throughout all those cells in the body, and it comes through our blood. So getting that heart pumping, keeping it healthy to make sure that, you know, we feel more vibrant. And of course, when we get up in the morning, a big part of our daily routine should be stretching. Keep those muscles flexible and pliable. And as we age in place, what happens is we kind of lose our balance. And so one way you can tell if you need to stretch more and move more is if you just try to stand on one foot. If you try to stand on one foot and you can't do that without, you know, the assistance of holding on something, that's a sign that your flexibility is not where it needs to, your balance is off. And of course, you know, if you fall at a older age, this could make you end up in a nursing home from a broken hip or something like that.
Oh, wow.
So making sure you maintain that balance through stretching.
Wow, those are those are all great things. Let me see how much I can regurgitate real quick, because this is good for me too. So first of all, in the morning, I need to get up and stretch.
Stretch, please.
Okay.
Yes.
And then secondly, I need to eat only during the daytime hours. These are things that I mean, I've heard about stretching before, but I never heard about eating only during the daytime hours. That's pretty powerful. So I'm working with my metabolism. My body is working.
Correct. Natural processes. Absolutely.
And then I need to weigh myself and divide it by 2 and drink that much in ounces of water every day. Okay. And so then after that, there were just a lot of other just good tips that I'm going to have people just rewind this and listen again.
Yes.
So I mean, those 3 bullet points right there are already powerful within themselves.
Yes.
So, yeah. So what can people do to reach out to you if they would like to get your help to, you know?
So right here at Volunteers in Medicine, where I'm working, we're actually a free clinic, full service, comprehensive primary care. As long as a person qualifies and it's 18 and above, no form of insurance, making an income of 13,000 up to 36,000, they can qualify for our service. And we provide all kinds of services. We have a Well Woman's program, breast exams, pap smears, mammograms, just stuff like that. And then we also have a lot of providers here that are specialists. So like 15 different specialties that are covered, from dermatology to gynecology, endocrinology, cardiology, and we provide our services free. So we have 250 volunteers. And what's happened is a lot of people, they want to take a compassionate approach to helping the community. And so like I mentioned earlier, I've been a volunteer doctor since 2012, which means that my services are 100% free because I just want to help people in the community. I've been very fortunate. I've been very blessed. I love Jacksonville. This is my hometown. So my mindset is, what is it that I can do to help somebody else in life? And so qualifying for these services here, comprehensive, free vitals, screenings, labs, everything, just making sure people can stay fit, because what happens, people can end up in the emergency room, and some people may treat that as primary care, but what happens also is it can set people out financially and economically, because once you get that bill from something that you probably could have prevented by hooking up with a healthcare provider, it can be quite shocking. And it can set you back generations. And so when generational wealth is built, you can wipe out an instance from an accident or illness and ending up in the emergency room. And then before you can even get started as a young person in life, you're already set back.
Right. Wow, what a good segue into the underlying thread of why we do this, which is legacy. You know, it is not a great legacy to pass forward not taking care of yourself and debt because of health issues. So just give me your thoughts about legacy.
So I tell young women, especially when I see some of the things that they're doing, and a lot of times it could be learned behavior, but I tell them you're eating for your grandkids now.
Mm.
And this kind of resonates with them, and it makes them think about, well, wait a minute, the things that I'm doing, it can have a lasting impact on my family. And then everybody says this runs in the family. But I said, well, wait a minute, it's your job to run it out of the family.
Run it out.
And then it starts making sense to them, because we all have DNA, and things, once they get coded in our DNA, they could be passed down to the next generation. And we really want to kind of break these different cycles and some of these habits and some of this behavior. And really, a lot of people do things that they do because these are coping mechanisms and strategies for them. But what's helpful and what's positive, and what are some of the things that we can focus on? And the truth of the matter is, people don't know what they don't know.
True.
And so that's why I really appreciate you providing this forum, this platform, so that we can share information with people. It's amazing. So thank you so much for allowing us to do this.
Thank you. It's been my pleasure. I've learned some things for myself personally, and I believe that this is also good to share with other people, especially, I think a big part of healthcare is, especially in the African-American community, a fear of doctors. I don't want to go to the doctor. I'm afraid of what he's going to say. And then secondly, the cost of healthcare, So they try to do home remedies and things to just do it themselves, So I think that having met you, it just sort of erases some of those fears, and it makes people willing to at least go and be checked out. I hope that that's the outcome. Yeah.
Yes.
Yeah. So what would be your message before I ask this question, I have to ask this question. Okay, Mr. Saxophone, I would love to hear you play. Not right now, but could you play something for us and send it to us, or come on and do a little something. I mean, we love music here. So
right.
I really, really love to hear the doctor play. So could you actually do that for us at another time?
Yes, I'll record something and make sure you hear it and share with you. I want something that could be very smooth and calming,
Yes.
That's the approach I like to take. I will definitely do that.
That would be amazing. And you feel free to, if you want to give a little testimony with it, that's fine. But I would love to hear you play. And so with that being said, I would like to hear your message of hope to the community. What would you like for them to know?
So I would like people to just try to focus on what's positive, focus on things that they can do. So often you hear people talking about, I can't do this and I can't do that. So what is it that you can do? Mm-hmm. Focus on what's positive, what's helpful, and connect with people, because social connectedness is really important. We found out even more now since the public health pandemic hit. But focus on making sure you have good relationships with people that you can count on. If you need a mentor, seek out a mentor. Yes. People are there to help. There's always hope in Christ Jesus. Rely on your faith, right? You can always do that. And then focus on things that can help people behind you. And the one thing that is so important is compassion, because compassion helps regulate our own minds. And so that's why I enjoy being compassionate with other people, because this balances me out.
Yes.
So be compassionate, be very forgiving, and work with other people in a manner such that you're giving them a little bit of hope in life. Because the truth of the matter is, everybody's got a sad story that we can talk about, right? Everybody does. Mm-hmm. But what is it something that we can do to lift our fellow man or woman up in life? And basically that's all I really try to focus on doing, is helping somebody else. Like I mentioned, I'm just here to help somebody else. I want to be a healing presence on this earth.
That is awesome. I mean, I couldn't have said that any better myself, because you spoke out my true heart for doing what I'm doing. And so I just want to thank you so much, Dr. Rob, for coming on and sharing with us. And I just feel like there's like a whole deep well of knowledge that we don't have time for in 15 minutes. So maybe some other time you can come back and talk again about something that's on your heart and mind that you've seen out there. But most definitely, please come back and play your saxophone.
Will do. Absolutely.
All right. Well, God bless you today. Thank you again for being willing to do this for us. And we will talk to you soon.
Thank you so much. It's been a pleasure.
You're welcome.
All right. Have a good one.
You too.